Let's go on with Calgary-Shaw, followed by Millwoods.
Thank you, Mr. Speaker. A couple of weeks ago, I asked a series of questions about the Child and Youth Advocate's most recent report that went unanswered. Since then, we've been made aware of a terrible trend in the system, the dramatic underreporting of deaths of children and youth in care. One of the minister's justifications for inaction has been to remind us that the Child and Youth Advocate is now independent and therefore the system is completely fine. Nothing to see here, Mr. Speaker. If all is well, why, as the Child and Youth Advocate has clearly indicated, are traumatized children and youth coming into government care not receiving the mental health supports they so desperately need?
Mr. Speaker, there's some very good recommendations that the Child and Youth Advocate has made, and I'm working through the three reports that he's giving us. In fact, I have them on my desk for review. We do have something which this government has recognized as a very serious and important issue, and that is the mental health of children and the supports for children with mental health issues. I've been working with the Minister of Health and with the Minister of Education to make sure the supports are in place, not just for children in care, but for all children. That's a very important issue in this province, as it is in many other places in North America, and that's a very important issue to be addressed in an even better way than we have to this date.
Honourable member.
Mr. Speaker, they've been working on this for 10 years, but given that the news of the last couple of days, namely the revelation that these children are dying in care at a much higher rate than the government will admit, and many have mental health issues that went untreated, does the minister accept that there is a correlation between these deaths and the lack of appropriate mental health supports for these children in care, and what is your ministry doing about it?
Well, Mr. Speaker, first and foremost, I need to go back to his suggestion that the children are dying at a higher rate. That's not true. What in fact has happened is that prior to 2012, we did not report on children who died of natural causes and accidental death that were not impacted by a third party in an inappropriate way. There were investigations, medical examiners and others determined that it wasn't necessary to go further. Since 2012, all deaths of children in care are being reported. We think that's important. That's an extremely important piece. Mental health is an extremely important issue, not just for children in care, for all children and youth, in fact, for all Albertans, and that's an issue we're addressing.
Mr. Speaker, the Child and Youth Advocate has done everything he can to sound the alarm on health supports for children in care, mental health supports. His warnings should send a chill down this government's spine. Again to the minister, when are you going to show some leadership, take some responsibility, and admit that this is still a major problem in your ministry?
Well, Mr. Speaker, we've received the Child and Youth Advocate's reports recently. We are reviewing them. The recommendations are very important recommendations, but I don't need the report to tell me that mental health for children is a very important issue, and in fact we've been addressing that issue. We have programs in place. We're putting more resources in place to do that, and we've been working very closely with the Ministry of Health and Ministry of Education to make sure that access issues are addressed.